Thanks everybody for coming out to LouVax, the national best practice for mass vaccination. That's not me just saying it. It's the New York Times, it's the Wall Street Journal. So we're really proud of our public health department and all the amazing volunteers that helped to make this happen. Just a little weather update. Obviously, it is cold, but the precipitation has stopped, so we got a break last night after our snow team being in operation for some 12, 13 days or so. So I want to say thank you again to the snow team for helping us get through this adverse weather. Given all of the situation, they did a really nice job in terms of keeping the roads clear. I would like to remind everybody once again, if you have a sidewalk and you're the homeowner, the business owner, please clear the sidewalk. There's people walking in the streets because the sidewalks aren't clear, and that could end up being a real problem for somebody. So please do your part by clearing your sidewalks to keep everything safe in our community. Our Resilience and Community Services team is continuing to work with the Coalition for the Homeless. We still have more than adequate capacity for people that need to get in and out of the cold. It's going to be cold again tonight before things start warming up here over the next couple days, and the potential rain that could come with that. So it's going to be kind of messy here once that starts happening, possibly Sunday or so. I want to thank the partners that helped us get through this most recent weather event. John Gordon with the National Weather Service and his team have been outstanding. LG&E and the water company, everybody kind of participating together. It is one of the things we do well here in our city. We work together well as a team, and we kind of sublimate any egos to the good of the city, and this was manifested itself just most recently with all of this cold, snowy weather that we had as well. All right, so with this weather warming up, that means we're back in full operation here at LouVax. Has been a challenging week. We had to close for 2 days, but we're making it up day by day. And then, of course, tomorrow we're holding a special session on Saturday for second dose appointments only. I want to emphasize again, this facility is for appointments only here. A lot of people were concerned, or some people were concerned, on their second dose in particular because of the regimen requirement of getting a second dose a specific couple days after the first dose. So it can go anywhere from 4 days early to 2 weeks after that 28th day for the Moderna vaccine. So there's not going to be anybody that's going to have to miss their second dose or getting the application of the second dose because of any rescheduling from the snowstorm. So look for more information from the Public Health Department on that so that you can reschedule accordingly. All right, so I want to thank our LouVax team here for their tremendous flexibility throughout all this and the excitement about tomorrow. So people are ready to roll on a Saturday. And I think one of the things we're going to start seeing here in the not too distant future is as we have more and more supply, you're going to see more and more locations administering the vaccine, or maybe more shifts here. But under the Biden administration here in these last 4 weeks, supply is already up 57% just through kind of getting more out of the existing manufacturing operations and the techniques with the vials and the syringes, et cetera. And then in about 6 weeks or so, we're going to start seeing a lot more supply. And then 8 weeks, 10 weeks. So we'll be going from a scarcity situation we have right now to having lots of supply for the community. So then the challenges are going to be how quickly we can vaccinate in many different areas of the community in many different locations. So that will change the narrative a bit. And our vaccine distribution task force is hard at work already on figuring out how to do that. We're having increased emphasis on equity and the challenges associated with that. We're making good progress with that. And that equitable emphasis is certainly represented in both our vaccine distribution task force and our communication teams as well. So you'll see more vaccines available at a location like this. We had an increase in vaccines going to our pharmacies as well this week. Our FQHCs, our federally qualified healthcare centers, are also getting more vaccines. So not huge amounts, but certainly more that we're getting vaccines into the arms of our community. All right? We're seeing, I would say, more and more people are definitely getting comfortable with the vaccine at this early stage. Obviously, there is more demand than supply. But as supply increases and we get to the latter parts of our vaccination strategy, we really have got to be focusing on people that are vaccine hesitant or vaccine skeptical. They might be hesitant because of some of the historical injustices with health care on Black and brown communities. And the reason why this is so important, one is we want people to be healthy themselves, but we want to be pushing as a city and a state and a country to get to herd immunity. And we, as you all know, we need to get to around 75, 85% of the people that have been vaccinated so that the virus, in effect, goes away or is minimized. So as we work more toward that goal, there are going to be more and more people that we're going to have to convince that the right thing to do is to get the vaccine for their safety, for their family's safety, and so the economy can reopen. So that'll be interesting for us as we get into that phase of the challenge, and that's several months out from now, and you'll see us deploy a bunch of different techniques communication-wise around that. But amongst that is when people are starting to say, well, you know, is the vaccine safe? Well, you can see that, you know, there were 70,000 people in the early stages of the testing. There's been over 42 million people have received a vaccine of some kind already here. And so you're seeing that, yes, this is safe. We're all still walking around. There's been no change in any of our physical reactions to this. I have received both vaccinations, and absent a little sore arm for a couple days, everything is just fine. So, and that's what you're also seeing with 99.9999% of the people that get the vaccine as well. So we're looking forward to getting closer to herd immunity in our city. We're a long way away from that, but in the coming months, we'll be talking more about that, and that is the best way for us so we can get rid of these masks and hug our kids and our grandkids, go out to your restaurant or favorite bar or whatever it might be, but get life back to somewhat of a normal situation, okay? And all this is possible because of the great partnerships that we've got with federal, state governments, and then facilities like LouVax. And LouVax has just been amazing. You all have been covering this now for 6 or 7 weeks. At the beginning, we didn't know what our volunteer situation would be, and would people really want to step up and help here. But volunteers just keep coming, and they keep coming with the same enthusiasm and the same kind of feeling of joy that they're able to help get rid of this dastardly virus. And we're doing that one shot at a time with some of the just tremendous reactions here from both our volunteers and the people who are getting the vaccine. So I really, once again, want to say great job to our public health department and the volunteers here at LouVax. All right, yeah, let's give it up for them. Thank you. They deserve that. So now we're going to hear from Connie Mendel. She is the Deputy Director of Metro Public Health and Wellness and the Incident Commander for our overall COVID-19 response. She's going to share the latest data with us.
I am so excited to be here today. One of the reasons is it allows my colleagues a day of work away from LouVax, so and just to help all of the great work that they're doing here. So our latest data, as far as vaccinations given across Metro by all providers since we began, we're at 142,983, so almost 143,000 doses, and over 40,000 people, 40,212 have completed the 2-shot series. So for here at LouVax this week, we are, in spite of being closed Monday and Tuesday, Wednesday and Thursday, 2,620 doses were administered. So those are 282 first doses and 2,338 second doses, that boost dose. Today we are scheduled to administer 1,523, and tomorrow we're scheduled to administer 1,000 doses. So, and all of those appointments are full. And just some things for you all to consider. In spite of the weather again, we'll be able to manage to deliver over 5,000 doses here at LouVax. And as the mayor said, tomorrow we're having a one-time only session from noon to 6 on Saturday, and these are for second dose appointments. We want to make sure that we get everyone their second dose in a timely manner. So, and all vaccinations, I cannot emphasize this enough, are done by appointment only. You must have an appointment. If you don't, please do not arrive. We don't want to send people away. And all of our appointments today, tomorrow are full. So we expect to be back at normal operations next week. Looking forward to the warmer weather and administering over 1,200 vaccinations a day. So and we'll continue next week with those phase 1B and any 1As that for some reason were missed or unavailable. And then we'll be working on booster doses, including those for our educators and NTI hubs, and then starting to vaccinate as well some 70-year-old and over individuals from West and Southwest Louisville. So again, I just want to say, please do not show up here at LouVax if you do not have an appointment. We do not want to turn anyone away. And for those that do have appointments, it's not necessary to arrive early. Please come at your appointment, the scheduled time. We have a dose for you. If you have an appointment, that dose is here. If everyone shows up at that time, it means that the process goes much more smoothly without delays. We've had some concerns, which I understand. My husband is an early bird type person, but when people show up 30 minutes or an hour early, it really creates delays for everyone. So that is it. Thank you all. Back to you.
All right, so just to clarify, when you get an appointment time, let's say of 10:15 a.m., that's when we want you to show up out in the parking lot, not necessarily when you're going to get your vaccination. All right, so there's been a little confusion about that. Okay, now we're going to hear from Dr. Ruth Carrico. Ruth is famously in the newspaper today about her storied history with vaccinations in our city and around the country as well. Ruth is a professor and family nurse practitioner in the Division of Infectious Diseases at the University of Louisville. And for our vaccine task force that she's on, she's also the nursing leader here at LouVax, which has really been amazing, as I keep saying, because this has been a lot of work. But what we all want to have is we all want to have joy in work. And if you have joy in work, you've never worked a day in your life. And when you meet somebody like Ruth Carrico, you can see what joy in work is all about. Dr. Carrico.
Thank you. Yeah, this is an arena full of joy. I'll have to tell you, for healthcare workers and others across the community that are waiting in line to come in and participate and care for their community, I think they're taking the lead on the Compassionate City initiative that we have had longstanding. So this is Compassion and Joy in full operation. So just to give you a little bit of information about these volunteers, we have had more than 5,800 individuals registered to be part of this volunteer corps. More than 2,000 have participated. So you can see there's always a waiting line for people that are interested in coming and helping and working. The total hours that have been devoted by individuals in our community that are working to care for our community is 34,039 hours. That is amazing, I think. 470 have given more than 40 hours of individual volunteer time, and those individuals have been vaccinated. So this is not only helping to show and demonstrate and care for the community, they are also teaching those that will replace them and ensuring then that we can continue and keep this going. So it's amazing, and it's a delight then to have the opportunity to recognize some of the volunteers that continue to make this possible and give amazing effort. So Callie Thompson is not here with us, but Callie has continued to provide outstanding service during many of the busy times of our operation. Jennifer Coe is with us today. Jennifer also has provided service then to patients as we have sought to ramp up operation and continue at this high level. So Jennifer, if I can provide you with this certificate of appreciation. All right, also we have with us Jose Gil Luna, that has also been one that was willing to continue to stay over. We'll have busy operations. We are continuing then to see more people. He will willingly stay and has worked multiple shifts in a row, multiple days, especially this week when it has been so cold and we've had to see a lot of additional effort. So Jose, thank you so much. All Right. In addition, Kelly Kowalski is not here, but also is one that has provided then expertise as one of our volunteers at many of our very busy hours, as has Carla Hopkins, who is also a nursing instructor, who is teaching students, teaching our future caregivers, and also serving as a volunteer. We have an additional person that I'm delighted to, because we don't always get to see many of the people whose faces are behind the scenes but are making this happen. So Carol, I would love to be able to express our appreciation, because you have been helping us make all of the scheduling happen. So Carol has been instrumental in ensuring that every time we have an empty spot, it is filled, and that we are getting then our community members in. So Carol, thank you so much for your efforts. It's always so much fun to have the opportunity to thank people. I have another opportunity to thank a very special group, and I think this is a group that we want to make sure that people do not forget about. And this is, who are the people that actually make the arena available and safe for us to be here and bring our community members in. So much work is done. I was telling David Beck this morning that when we get here in the morning and we're starting to set up, his team is already on site. They're making sure that the arena is clean. They're looking at disinfection. They're helping us look at indoor air quality, all of the things that are important to us during this pandemic. So David Beck, the CEO for the Kentucky Fair and Expo staff, and then Kevin Moore, who is the general manager. I'd also like to provide some special appreciation, not only from me, who sees your work every day, but every one of these workers who is very appreciative of your hardworking staff and the leadership that you are showing in all of their efforts. You're making it happen. Thank you. A long-standing history with David and all of his work in the community. Yet again, thank you for your leadership. If anyone has any particular questions that I can help answer, I'll be glad to do so.
Has there been any effort to use the time that the homeless folks in our city have been within shelters for this white flag period to possibly consider vaccination for either one of you?
Okay, yeah, our emphasis on the homeless population is make sure that they have been sheltered. We have way more capacity, 200 plus open beds as well. Well, the focus there has been on people that work in the homeless shelters because of the 2-dose regimen. So we're waiting for the Janssen vaccine, which is a 1-dose regimen, and then the homeless population we prioritize for that. It's been difficult to kind of get a 2-dose practice with some of our homeless population. So they're definitely in the plan. Well, so we've got, we want to get all of our 70 plus that are willing to be vaccinated as soon as possible. So this facility here has been mainly for employer groups, but we have some capacity opening up. So we've gotten names from some of the hospital systems, so we're bringing their backlog of 70 plus into here so we can move through them as quickly as possible so we can be finished with 1B. Now, some of the hospital systems are partnering with some of, let's say, our churches, for instance, in West Louisville. What we found is, especially with some of our black population, they're much more comfortable going to their church to get vaccinated. It might be more convenient for them as well, but when they're invited by their pastor, we're getting a bigger uptake on getting the vaccine in place. So that's part of our equity program, if you will, to make sure that we're communicating in as many different ways and making the vaccine available in as many different ways throughout the community as well. So Norton and U of L are partnering with a bunch of our churches that way, and we'll continue to do so.
Another question. You had mentioned starting to soon see maybe more shifts here. Obviously, like tomorrow's business secretary appointment to the event. Is tomorrow kind of a nice little trial run on seeing how Saturday operation will go?
Yeah, it's a little too early to speculate on whether we're going to go to multi-shifts here or not, because we're going to have strategies all throughout the city, but we've got to make sure we've got staffing and how we're going to do that. So the Vaccine Distribution Task Force will be commenting on that. But, when you think about the capacity that we have here, we've had a record on one shift, I think, what's our record now? 2,100 vaccines? You know, so when you think about 2,100 in one shift, and we're basically using 5 shifts in a week, if you had 7 times 3 or 21 shifts, you can see how much more supply could come through here. But we don't have the supply to do that. But we're very confident in this facility's efficiency. We've continued to increase week after week in a very dramatic way. So as we get more and more supply, you're going to see different strategies throughout the community, and we'll be communicating on that in the next couple of weeks. Yeah, they've been moved into 1B, so let's, Connie?
So just to repeat, the question was on childcare workers. They have been moved into phase 1B, so which is what we're currently in now, and there we may even have some people coming through today, but definitely next week. So we are working, collecting rosters. So childcare similar to healthcare, and first responders. We're working through the employers to provide the information so we can schedule those childcare workers. Yeah, so obviously the weather impacted us, but we are able to reschedule all of those, if not now, within the coming days. So we have capacity to do that. If those would be first priority if you already had a scheduled appointment, but first dose will go after second dose, and just because of the timelines. No, we're not concerned. We have capacity to do that. Go ahead. We are still meeting that 90%, using that on a weekly basis. That is why we added in tomorrow, and and we are still at 0 waste. Our supply is similar for next week as it was this week. But the community, as the mayor had mentioned, our family health centers and others are beginning to get smaller allotments. So, and they are just great providers for their patients. We have been working with them along with the health systems throughout this to get their patients vaccinated. So we will continue on with where next week will be similar to what this week was scheduled to be.
Mayor, you mentioned soon going from a scarcity of vaccine doses to an abundance. How does that lead to into 1C? Could that get to 1C sooner? And could that lead to perhaps another mass vaccination site here in Louisville?
Yeah. So when we talk about increasing, like, so for instance, the increase from when this program started is up now 57% from the federal allocation. So that's off a relatively small base. We think we'll be going into 1C in mid-March? In mid-March type of area. So late March or April into 1C, which of course is a really big category. The increase in supply could likely lead to another mass vaccination site that would be operated by FEMA. And our number one priority for that is to have that at Shawnee Park, just like where we had the testing facility. And we're interested in that as long as it comes with an additional supply of vaccine. So we've communicated that to the federal government. They're trying to figure all this out as well. But that's our number one priority location, is to have it at Shawnee Park. Yes. So that's a hot topic of our vaccine distribution task force. The number one criteria will be age. What everybody knows with the virus is that it is more deadly for people in older populations. So that's why we started with the 70 plus cutoff, and 1C is going to be at 60 plus.
prioritized those that had been postponed or canceled. There are some others, mixed in there that are new. And that's one thing that the mayor had mentioned. There is extra time. That second dose for like here with Moderna does not have to be on day 28, and Pfizer does not have to be on day 1. So we've gotten a lot of calls. There's some anxiety, but there is plenty of time. So and it will be effective. Yeah, and part of that obviously is weather related. And that was part of the point that I had brought up earlier, that please show up on your appointment time. If someone's here, some people show up half hour, even an hour early. It just continues to stretch that out. So we're much more efficient when people show up on time.